Hi, I'm Monica Ghost, and I'm excited to join you today with Denise Rodriguez to launch our first patient safety podcast. Denise, before we dive into the podcast, could you start off and share a little bit about yourself and what you do here at Ultragenics?
So today is a special day, and it's a pleasure to be here with you. So I'm Denise Rodriguez. I'm Pharmacovigilance Director for America Latin, and also I'm based in Brazil, and I serve as the local responsible person for Brazil and for our health authorities here.
It seems these days we all have our favorite podcasts, and it would be wonderful to hear how did this concept for the patient safety podcast come to life? What was the inspiration for this podcast series?
Yes, Monica. So thanks for this question because, Monica, I always had this wish to have an opportunity to share with our internal colleagues what and how pharmacovigilance and safety teams works and how we provide safety for our patients and in an easy way. And when you told me that you had the same wish in the beginning, it made me feel more enthusiastic to work with team and turn our dreams into reality. So the opportunity to have the technologies to help us to support people to learn more about pharmacovigilance, safety, with a modern approach, being innovative, and the Patient Safe podcast will be able to reach out our team worldwide sharing our experience. So it's a great opportunity to talk about our dreams and about our areas.
Denise, I'm really excited that series of topics we have lined up for our safety podcast. Can you share with our Ultragenics team what they can expect from the podcast?
Absolutely, Monica. So the theme for World Patient Safety Day for this year, 2022, is medication errors. Our first episode starts with this important topic that has impact around the world. And I'm also excited about the lineup and main future topics which will integrate questions we have received from our colleagues around the globe. They will hear from members of our global GSPV team and the work we do oftentimes behind the scenes. We plan also to release at least one podcast per month in multiple languages, and we will communicate new release in the What's New Ultragenics. So stay tuned for more information about it. And last, we hope you will join our journey and share your ideas for future podcasts that would be available to you.
Great, Denise, thank you. So as you mentioned, medication errors are the focus for this year's World Patient Safety Day. And we know that medication errors are a leading cause of injury and avoidable harm in our systems, in our healthcare systems around the world. And while despite our best interventions and that are developed, we also know that their implementation can vary depending on the healthcare systems around the world. Weak medication systems, human factors, all contribute to medications, which can result in severe harm and even death. So, and I think about medication errors from a pharmacist's perspective, and I think back to my schooling and my training, and when I was working as a clinical pharmacist in the hospital, it was drilled into us the 5 rights for preventing medication errors, which was really core to our individual duties. And for those of you who haven't heard of the 5 rights, what this refers to is the right patient, the right drug, the right dose, the right route, and at the right time, which is all very good and it's very important. But this focus is more on our individual actions and performance rather than human factors or broader system deficiencies. And so, Denise, as you think about medication errors and their role here at Ultragenics, can you share a bit about how you help Ultragenics and in the work that we do at Ultragenics prevent or mitigate medication errors for our rare disease clinicians? Denise, can you share with us your role in preventing and mitigating medication errors for our rare disease community?
Thank you, Monica, for this opportunity. So this is our big topic for this year from our World Health Organization. And in my role, what is so important is the opportunity to have contact with whole employees in our Latin America, where I can provide trainings and help them to identify and how they can check this type of possibility about a medication error with the patients by physicians who are treating our patients from ultragenics. And of course, our products prescribing information, also known as the product label, is the main communication tool between ultragenics, our prescribers, healthcare professionals, our patients, and their caregivers for the safety and effective use of our products. So, of course, they will use our core document to support, but to have the opportunity to stay with the employees, and when they share with me questions how they can support the physician with this type of scenario, the opportunity that I have to provide to them the information, how they needed to notify, how they needed to identify, how they can provide more details about this, is the way that we can minimize, that we can try to change and mitigating these errors, providing information, Monica, always. So since they know how they need to follow, and following, of course, our core documents, they can do the best to provide healthcare professional information about medication errors.
Thank you, Denise. And if our team has questions about this podcast or future podcasts, how can they reach out to us?
So we will have our information inside our WhatsApp mail, of course, and if they have any questions, doubts, or they want to receive information from us about curiosity, for example, they can message it to our team. We have our email address in our page, so you can send us, and our team will be very pleasure to help you and clarify your doubts. So, and of course, the podcast is preparing, thinking in you. So you will see the next episodes with more topics about your questions. We are working to have your answers, but if you have any other new questions, please let us know, and we will work to have your answer in our next episodes as well.
Thank you, Denise, and congratulations on all of your work to put forward our first patient safety podcast.
Okay, thank you.